Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. I have with me today Dr. Brian Bell, and he is the president and CEO of Arkansas Hospice. Yeah. Dr. Bell, thanks for being here.
Thank you. I always enjoyed coming. I was here last year, had a great time there, so thanks for asking me back again.
Well, you're welcome in a new role here, so tell us about your new role.
Yeah, so last year I was the chief medical officer, so it's kind of head doctor at Arkansas Hospice, and so did that for 8 years, and so about 3 weeks ago, I got this great opportunity to be the CEO and president. So, and in this new role, it expands what I get to do. We have a whole family of care. We got palliative care, primary care, I have a personal care service, and now I get involved with all that, right? Before I was kind of in my lane here, taking care of medical issues. Now I get to kind of spread my wings a little bit, do some different things, get involved with things like our foundation, really have a more of an input and influence across our state about the hospice care that's being provided across our state. So very excited about that.
And so you mentioned before your role as chief medical officer was patient care. What does Arkansas Hospice extend to? I mean, it is pretty extensive.
Yeah, it's pretty extensive. So basically when I got here, we were a hospice company. It's called Arkansas Hospice. And so since I've been here in the last 8 years, we've started palliative care, which is a program where, our hospice programs in 44 counties, our palliative care programs in about 34, and that is in 3 hospitals, and different from hospice in the fact that it's a little smaller. It's not as maybe as comprehensive. It's usually a nurse practitioner who's going into the home, focusing on things like advanced care planning, pain and symptom management, care coordination, caregiver burden, and things like that. So, and then probably 3 years ago, we started primary care. So with our palliative care program, we're more consultants. We work with the other doctors, but in our primary care, it's for the patients that are truly homebound. They cannot get to see the doctor. And what we found in COVID was, we were seeing these patients on palliative care and they were not seeing their doctor for years. And so we said, we need a program of primary care so that we're taking care of their, antibiotics and their blood pressure and their diabetes. And so we become that provider. And then we got a personal care service. So if you need help in the home 24/7 or with our first choice senior care, then you can invite someone in the home to kind of help take care of, your loved one in the home and do it that way. So we got what we call our family of care. And that's our family of care.
So there is a difference between hospice care and medical care.
Sure.
What are the differences?
So to me, hospice is really this specialized, compassionate, comprehensive care for people facing serious and life-limiting illness. With the goal of that is to maximize people's quality of life, right? And we do that through a great team, a team of doctors, social workers, nurse practitioners, chaplains. We have this whole what we call interdisciplinary team, and they're all working together to really kind of maximize that quality of life for that patient. And we're not, people are a lot of times focused on, doctors, cardiologists or your cancer doctor. We're kind of focused on the whole person care, right? It's not just a disease. We're focused on you as a person, all of you as a person, and all the needs that you may have as a person, especially a person who's facing a life-limiting illness.
And there are some common misconceptions people have about hospice care. Tell us what those are.
Man, we could spend all day on those. So, and we get them a lot, and it's getting better. I'll be honest with you. I think people, especially our medical students that are coming out, really understand it a lot better. I think one of the things people think that it's a place because maybe their loved one died in a place called hospice, but hospice care usually is wherever that patient is, in the home, in ALF. And 99% of the time, that's where we take care of people, where you want to be. Because most people, when you ask them, where do you want to be? It's not a hospital. It's not a nursing home. It's in their home. And so we're going to kind of take care of them there. But the other thing I think people think of is they kind of have this idea of what a hospice patient looks like. They think they're frail, they're elderly, they're bedbound. And that's not true. I mean, I have patients today who are traveling the country on cruises, on hospice care, or have been on hospice care, or going to sea. I got people that are still working, sometimes even part-time. I got pediatric young patients, very young on hospice. And so, the the patient that we think about is, we do have those type of patients, but that's not the only type of patient that we have. We do have other types of patients who are really having a great quality of life. They're traveling, seeing some families across the country. And our job is to make sure that they can kind of maximize that life that they have for as long as they can.
And you mentioned maximize their life. It's compassionate. It's
Sure.
very tailored care
Right,
as well.
right. Oh, yeah. Yeah, it's very tailored. Our plan of care that we have when we have a patient that comes on, we have a social worker that goes out and a nurse and a chaplain, and they go all and assess that patient on what's going on kind of in their individual areas. And then they write a plan of care, all collaborating together. And then after that, the physician reviews that plan of care and says, yes, this is the right plan of care for this patient. But it's not cookie cutter. It is really tailored to what the patient needs and also what the family needs as well, not just the patient. So what their needs are.
And why is hospice care so crucial in the end of life process? And how does it improve the quality of life for patients facing terminal illnesses?
Yeah, so as you get older and get maybe a very serious illness or life illness, serious life, maybe ending illness, it is much, our traditional medical system maybe is not able to handle that. As you get sicker, your needs get more and more and more. And the system we have in medicine today doesn't always meet those needs. And hospice is really there to meet those needs with our interdisciplinary team, and whether that's emotional, physical, spiritual needs, you have all of those. But also, one of the great things I love about hospice, there's, we do those things, but, it's the salt of life, the sweet things. I also have a foundation that just does things. Like I was just meeting with them yesterday, and so one of the things they did this winter was, buy propane for someone. They're getting cold. But we also got to fly this family in from California to be with their loved one, right? And they hadn't seen each other for a while. And so this patient that we had said, I want to see my family from California, and this family maybe couldn't afford that, and so we spent our money to make sure that they could fly in and spend some quality time. That's the thing that makes it special. It's not just those, treating those pain or treating that. It's the little things, well, not little, actually pretty big, things that we get to do for patients that kind of makes life sweet for them.
So it's not just emotional, physical, it's very psychological.
Sure.
I mean, there's benefits for all of those things.
Yeah. You have all those things, and that's why we have a social worker, right? So having that person who, can listen to that patient, sit there. We call it the power of presence. Just sometimes just sitting and listening. You don't know how powerful that is. Not to always be talking. That you just have an ear that's available to you, and hopefully they can fix a lot of your problems. Maybe sometimes our social work, I sign things all the time like FMLA paperwork, or help you with disability paperwork, or other things that you may need to do, some really physical things. But a lot of it's just holding your hand. Let's hear what's going on, and let me see what I can do to help you.
And it's not just the patient. You guys offer a lot of resources for families, right? Caregivers.
So I'll be honest with you, most of our work, I think, is for family and caregivers. I think what I found, and I've been doing this since 2006, patients generally do fairly well, but their families don't always do as well. And in hospice, the median length of stay is only 17 days. So half patients will die within 17 days. And then that 17 days, we're working with that family, or more, but, to teach them, educate them what's going on, train them how to take care of that loved one. So, that's real important. But after that patient dies, we have a bereavement program. And for the next 13 months, we're going to take care of that loved one. Now, that doesn't happen anywhere else. No hospital, no nursing home, no medical clinic does that. And I can't tell you how many times I've sat at a bedside, let's say, of a man, and we're talking about what's going on, and he says, what's going to happen to my wife? I mean, we don't have kids. Our friends are all died. We live out here in the country, and who's going to follow up? Who's going to take care of her? And my answer to him is always, we will. We're going to follow up. We're going to have phone calls, and follow up with our bereavement team to make sure. And you can just see their face just kind of relax, like, I'm okay with that. And it's almost at that point don't feel like they're abandoning their loved one, that it's okay. because their concern is not about what's going to happen to them. Their concern is what's going to happen to their loved one. And by offering things like bereavement services, we can give them that solace and peace that they really need.
Is palliative care different than hospice care?
Yeah, it is different. I think there's a lot of overlap, right? And we have our palliative care program, and the goal is still to provide quality of life. I mean, that's the goal for both programs. With hospice, it's bigger and more comprehensive. With our palliative care programs, we have our nurse practitioner, and she's very experienced, or he's very experienced, and they're focusing while they're there visiting with you. We're focusing on care coordination. Can we get you to the doctor? We also focus on things like food insecurity. Can we find food? In the case that we talked about, finding the propane was actually not even a hospice patient. That was a palliative care patient who we went to their home and they were freezing, and they were going to the emergency room all winter because they get cold. And so we bought them a heater. That's not the propane. We bought them actually a heater to put in their home so they wouldn't freeze, because they didn't have in this kind of drafty house. We do a lot of advanced care planning, things like that. So palliative care is, like I said, a very important part of our family of care, very helpful to patients and their families, and really getting them on track. And then we call that our palliative care is our extra layer of support. They have their doctor, maybe they have their cardiologist or their cancer doctor. And then we have us kind of wrapping around all those, kind of tying that all together, and help, once again, to fill a lot of gaps in care that maybe the primary care doctor or cardiologist or some other physician or other healthcare providers may not be providing.
And end-of-life conversations can be hard for families. What are some tips and things that might help make those conversations start easier?
Well, I'm glad you asked, because I think the very first thing is just advanced care planning. And just in a couple weeks, so April 16th is National Healthcare Decisions Day. And so it's the time to remember, it's the day after April 15th, right? Death and taxes. So that's why they do it the day afterwards. But the idea is everyone over 18 really needs that advanced care planning done. And so I think that's really, really important that you can do those type of things. And so that's a great place, I think, to really start. I think if you do have questions or wondering even, am I available? It's even available for hospice or palliative care. You can always call. You can call our phone number. We will, we'll come out and evaluate you. And, usually if you have a serious illness, you're going to fit in one of our programs, right? Maybe you're not a hospice, but maybe you're for palliative care. And what that palliative care provider then will help facilitate those conversations. They'll start that conversation maybe between a loved one and their family, and kind of be that intermediary to help guide that conversation. So so it's not so tough, and that provider that we have, our palliative care provider, can really kind of guide that conversation in a way that's, compassionate, empathetic, but also real, so that we can make real decisions about what's going on with someone's healthcare.
What do you think the future of hospice care in Arkansas looks like, and how do you see that evolving?
Yeah. So I think we got a great future. We have great providers in the state, not just Arkansas Hospice. There's across our state, almost every county has 4 to 5 hospice providers. And when we look at the quality indicators, we get kind of report cards on how well we're doing. Arkansas always scores above national average. They're doing a really, really great job. So we're doing a great job. Now, I will say this. There is legislature. I've been fighting in the legislature for the last 2 weeks. There's a bill that's trying to bypass what we call our permit of approval process, meaning the permit of approval process, this group looks at each county and says, oh, we need a hospice provider in there and provide a license. So the bill that's trying to go through right now is one that would bypass that and would expand that and really erode what we call this permit of approval. And when they've done that in Texas, they've done that in California, what we've seen is we've invited fraud, abuse, and lower quality. And so that, to me, is a big concern. I'm afraid that they're really trying to push, we're trying to get away from what we call the permit of approval process. And I'm afraid if we do that, we will not have the quality care. And also I'm afraid we may have inviting some fraud or abuse into our state when it's unnecessary, because we got great data right now that's saying that the hospices we have in the state are doing a great job.
So what do you want the healthcare community to know, and the general public, about Arkansas Hospice before we go?
Sure.
The resources that are out there, should they go to your website?
Sure.
Can they reach out to your office if they need help?
Yeah, so you can reach out anytime. I said, if you have a question, you can always give us a call. Our website's probably the best, arkansashospice.org. You can find us on Facebook and Instagram if you're into those sort of things. But, one thing, and so as an organization, we're pretty much all over the state. We're from Bearville down to Monticello, Hot Springs to Batesville, so we kind of have a big service area. I think one thing I want to say is a couple of weeks we're having our big fundraiser. It's called Party at the Plaza, and it helps raise money for all these things that we do, flying people in and propane and all these things that we get to do for patients and the care that we can provide. It's on April 26th, 2 p.m. at Argenta. And they got bands all day, including Arkansas. I don't know who they are, but I hear they're great, so I'm excited to be there that day to see them play. We have food trucks. We have things for the kids. The other thing that day is my predecessor, Judy Wooten, will be getting what we call the Compass Award. And it's the kind of the biggest award that our company delivers for the dedication of the years that she spent as our CEO. She was previously a COO and then became the CEO. And I think we're excited to celebrate her tenure as a CEO. And then the last thing, all right, it's kind of a teaser. I can't even tell you what it is, but we're going to make an exciting announcement that day. We'll be making that day about the future of Arkansas Hospice and kind of the direction we're going. So I wish I could tell you what it is, but I'm telling you, come on down. You'll hear about it in person. Enjoy, like I said, enjoy the food, the fun, the music. It is a big party, and come on down and enjoy that. And once again, it goes to our mission, right? Our mission is to help people at some of the most vulnerable points in their life. And this party, even though it's a party, the meaning behind the party is that money that we get raised there goes right back to our mission, which is important, to improve that quality of life for those facing, serious and life-limiting illness. And so we're so proud to get to do that. But yes, if you can make it, we got a VIP tent. We'll save a spot for you.
Dr. Bell, thanks so much for being here and talking about the mission of Arkansas Hospice and for all you do.
All right. Well, thank you so much for having me.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.